Participants, you can ask questions at the end. Okay, so please start.
Yeah, good afternoon. Myself is Dr. Manjunath. I'm heading a VCC, Veterinary College Asan from Karnataka. Today I'm discussing about ultrasonography in large animal practice. It may be helpful for the veterinarian, those who are registered. It may be the new topic for an agriculture, maybe an horticulture, or maybe some other sector other than in a veterinary. I'll highlight much more what are the cases we get in a veterinary and how agriculture people or maybe an horticulture people they can contribute for this, how we can progress with the treatment like that. I'll go ahead with this. Basically, the ultrasonography is a non-invasive, safe, economical, reliable tool. Is a less stressful for the animal as compared to the radiography. And you can see, compared to the X-ray, you can see the movement of an organ here. And you can employ, especially in large animal, taking X-ray of an abdomen or maybe thorax is somewhat difficult. Where they can employ this ultrasound as an alternative tool for diagnosing of some of the disease related to the thoracic cavity and some of the disease related to the abdominal cavity. Seeing this ultrasound can be employed for a diagnosis of diseases like diaphragmatic hernia, reticular adhesions, reticular abscess, peritonitis, pleuritis, pericarditis, ventricular, any growth in the heart, and any hernias. And it's also helpful for differentiation between cyst, abscess, hernia, and tumor. Some extent we can do that. This is some of the photos they're showing you what you are doing in ultrasonography regularly. Coming to the picture, where from the right side, what are the organ can be scanned by using ultrasound? That's a one is depicting, we can scan for a reticulum, where you're going to get in a biphasic contraction of a reticulum. 2 is a abomasum, 3 is a omasum, the fourth one is a liver, fifth one is in a gallbladder. The above one are just in front of an one, we can scan in a heart on right side also. This is photo on left side. 2 is a reticulum. Sorry, 1 is a spleen. 2 is a reticulum. 3 is the heart. The fourth is a kidney. You can scan in a heart both left side and right side. Usually, I'll suggest most of the time, please go for a scanning both left and right side. So maybe the problem related to the heart can be diagnosed by this technique. See the video. Here, this is a normal reticular contraction. This is a biphasic contraction, will say. It will contract, go back, again it will contract. This is called as a biphasic contraction. Some of the cases that there will be reduced reticular contraction. Usually, if you keep it around 6 intercostal space for around 2 minutes, you need to get minimum 2 or 3 contraction. If any, the decrease in the number of a contraction, we say is a reduced reticular contraction. It may be due to the plastic impaction, or maybe TRP, traumatic reticuloperitonitis, or maybe any abscess in the reticulum, reticular adhesions, diaphragmatic hernia, and also pericarditis. See, this is a photograph showing and video also. Reduce reticular contraction. It may be due to the plastic indeficiency. We removed around 30 to 40 kg of a plastic, where the most of the time we're using in a plastic in day-to-day purpose. This is contributing so many diseases in livestock. Not only livestock, you can go to the any that's on a beach side. Some most often a wild animals also get affecting, and birds also is going to get affecting. That usage of a plastic has to be minimized. This is a detrimental effect to the animals also, and also all other living human, including human being, all other they're suffering with that. The reduced plastic usage is much more important. In this case, we removed around 40 kg of a plastic. That operation is done by myself and Dr. B.V. Shuprakash sir. It's in a Bida College, Bida Veterinary College. Sometimes the reduced reticular movement, or maybe you can see between the reticulum and the spleen, the fibrin is floating. This is a clear-cut case of a peritonitis. This is traumatic reticuloperitonitis. Here, animal is going to live in a food and everything. And if you go for a blood checkup, there will be increased total leukocyte count. And when you go for ultrasound, you can see some of a free fluid in the abdomen. This case, this accidentally animal was passed away. After confirming that, these are the metallic foreign body, they pierce through in a reticulum, they gone to the abdomen. That is resulted in case of a traumatic reticuloperitonitis. Most of the time, we'll throw in some metallic object here and there. That usually the animals, what are there? Then what is going to happen? They will start grazing this type of a metallic object, automatically this metallic object will go to the stomach, they will going to pierce it. As much as possible, wherever the animal grazing area is there, in that particular area, usage of a metal object or maybe throwing of a metal object can be avoided. That will be the beneficial towards the animal. Otherwise, it may lead to the death of an animal also. This is a one typical case, that is a traumatic reticulopleuritis. Most of the time in a veterinary practice, we'll say TRP, TRP. TRP means traumatic reticuloperitonitis. But here on the typical case, we got it here, traumatic reticulopleuritis. Here, this animal is came with a history. It's not taking a food properly from since 1 month. Once you give some painkiller or a steroid, it will take for 2 or 3 days. Again, it will go for again halfway. We are subjected for an ultrasonography. You can see here on an left side, heart is compressed on one side, but right side completely fluid can be seen. When you go on the right side, the completely fluid is there and heart is also moved downwards. Okay, this suggests that something is there and only the liquid is there in the right side of the lung region. But accidental animal was passed away. After that, we are subjected to a postmortem. You can see that total right side of a lung is liquefied. Left side is completely normal. You can see the fluid, two worst condition. You can see here, the heart is normal, left side of the lung is normal. Only the right side of the lung is get affected. Here it's due to the what is in a metallic object. I told you some of the people they'll throw some metallic object outside. This will accidentally grazed by an animal. This metallic object is passed through from a reticulum, then it's got entry into the right side of an lungs. Automatically, right side of the lung completely liquefied. As you know, that ruminants is having a complete mediastinum. That's why only one side of a lung is get affected, other side of a lung is functioning normally. That's why animal, once you give a steroid something, it's coming back to the normal. Otherwise, this is a more dangerous thing. That's why that's a metallic objects. They are worst thing. They're responsible for the death of an animal also. This is a case of traumatic reticulopleuritis. Again, some abscess. These are the incidental finding during the postmortem with a confirmation of the ultrasonography. See this is an abscess what you diagnosed. This is a case, reticular abscess. Yeah, the most of the time I told you the foreign body, they will migrate out of an thoracic cavity. They list the formation of an abscess just behind the elbow. It may be on the left side or on the right side. Maybe in a day-to-day practice, if you get any swelling on the left side or on the right side, maybe it's a too huge swelling, you can examine it. May be an abscess. It may be related to the migration of a foreign body from a reticulum to outside of another body cavity. Usually, once you lance the abscess, you can palpate for a foreign body. The most of the time, you may get in a traumatic foreign body. These are some of the cases what you're getting in a traumatic foreign body. You can see here, this is a buffalo, tota, the traumatic foreign body out. This is some of the case of an reticular adhesions. This is, you can see that usually the heart will be separate and reticulum will be the separate. Heart, if you scan it, you should get an heart separately and reticulum separately. Yeah? When you put it around for 15 intercostal space, I can clearly see in a reticulum. I clearly see in a reticulum on one side and also heart on the other side. Maybe the both are together is there. This is a confusion. It may be a suspecting for a DH. Same animal is subjected for the ruminatomy. We confirm this animal is suffering with an DH. DH means diaphragmatic hernia, where the abdominal content, abdominal organ, they will migrate towards the thoracic cavity. Then after confirmation, we identified, we done a surgery. See, this is an hole, what is existing, we are suture. Then this is a complete closure of an hole. This is one more again DH case. See here in the left side, heart is there. Below the heart, you are getting an hyperechoic structure. This is an reticulum. Usually, if you get a reticulum at the fifth intercostal space, in an advanced pregnant animal is a normal. But in normal animal, if you get it on fifth intercostal space, you can suspect it may be the DH or it may be an vagal indication. Here, just below the heart itself, this is I can able to see heart is there. That's a reticulum is there below the heart. Here, in case of a right side, heart was completely masked with the reticulum. This is a confirmation that the animal is suffering with a diaphragmatic hernia. But we planned for a surgery, but unfortunately, animal was died before the treatment itself. See, we are again gone for a postmortem. This is a diaphragm, this is a reticulum, and this is a lung. Clear-cut case of a diaphragmatic hernia. Once you take out the reticulum, that particular part, you can see the hole here. This is one more case where the buffalo eve came with an recurrent bloat, not responding for a regular bloat treatment. Then we subjected for a ruminotomy, and before that we had done ultrasound. Ultrasound is confirmed animal is suffering with a diaphragmatic hernia. Then we done a ruminotomy. Through rumen, we confirmed that the diaphragm has been herniated to the thoracic cavity. Under general anesthesia, we done a midventral laparotomy. We taken out the reticulum out. This is an anesthetic team, we are operated team. We done an operation. This is animal. After complete recovery of an animal, it came back to the normal. After 1 month, or maybe after 10 days of a surgery. As I told you, that ultrasound has been used to diagnose the reticular movements and diaphragmatic hernia, some of an reticular affections. Is one more common problem in a large general practice is in a pericarditis or traumatic pericarditis, we said TP. Usually, we'll go for auscultation, we go for a blood test, everything will diagnose it. Along with that, if we add an ultrasound, you can diagnose in a pericarditis. Usually, based on ultrasonography, pericarditis can be divided into the 4 types. One is serous pericarditis. Then one is a purulent or a suppurative pericarditis. Third one is a fibrinous pericarditis. The fourth one is a constrictive pericarditis. Depending upon how it will go to look in an ultrasound, based on that, we can divide it. You can say these are the 4 types of a pericarditis. These are some of the animal that are affected with the pericarditis. You can see here, this is a fibrinous pericarditis. Left side, what you are seeing is completely, you can say bread and butter appearance will say. This is a fibrinous pericarditis. Right side is a suppurative pericarditis. Only you can see the hyperechoic. The things is going to floating in an anechoic area, suggestive of a suppurative pericarditis. Usually, once we diagnose, then we go for ultrasound guided pericardiocentesis. We collect the fluid, we can subject it for that's an ABST and also cytology, and we'll go for a culturing also. Like that, you can subject it for something. This is another. The first case in my career, we diagnosed a pericarditis is around 2012. We diagnosed through an ultrasound. Then we done a 5th tube resection under general anesthesia. We taken it around 6 liters of an pus from the thoracic cavity or from the pericardial cavity. We taken it around 6 liters of a pus. This is an operative procedure. That what is the thing? Usually, if it is an advanced pregnant animal, is there? This is a video. You can see that before an operation, we are scanned on a confirmation of fetus. This is a fetal heartbeat. After the 15 days of an operation, animal is given a birth for a female cow. Where in an advanced pregnant animal is there, if animal is suffering with a pericarditis, if you attempt it, you can save the life of an young one. That is my intention. Don't leave the cases if you get the pericarditis case. You start reading the pericarditis case. This is one more. We have done a 5th resection in a standing and a local. Earlier, what I told you, it is earlier what I told you that you are done under general anesthesia. This is a case you are done a surgery under local anesthesia in a standing. We can see that pus is coming through the water coming through an tap. Okay, the once the heart is pumping, the blood also is coming out like that. Yeah, this is a post-operative animal. You have done a ruminotomy also. We done a pericardiotomy, 5th resection also. This technique we modified. Rather than opening of a 5th resection, we plan to go with a catheter. We tried with one is human catheter. There's a 28 FG trocar chest catheter that we have placed through an ultrasound guidance or maybe ultrasound aided. We pass the catheter into the pericardium. We drain the pus. See here, that's we are placing. You are placing the catheter. This is a human chest line catheter. We are leaving now. See, that's once heart will going to move, catheter also will going to move. This is a case you can see that the pericardial is flowing like an water from the tap. Okay, this is if we have done it without opening of anything, only intercostal space. We place the catheter into the pericardium. We drain the fluid from the pericardium. This is what you have done it. Again, the cost of a catheter is around 1,600 rupees. Then we thought we'll simplify it. Okay, then we shifted for a Foley's catheter. Here, see, before going that, I told you that when you're going for a scanning of a heart, you're supposed to scan both left side and right side. See here, this is a case of an serious pericarditis. It's having only the right side. Left side is completely normal. Only right side is get affected. This is the right side. Along with my colleague, we placed a Foley's catheter. Instead of going for an that's an trocar chest drain catheter, we started using an Foley's catheter. It's around 120 rupees. We started see the thing. Maybe you can save the money over here. This is a animal. Again, we have taken out all the fluid and everything. This is the animal is a first carving. Then this animal has given a second carving also. Then they're getting around 15 to 20 liter per time. That's a milk yield you are getting over the owner is happy. Where most of the time we will neglect the case of a pericarditis. You can treat it, you can save the life of an animal. Again, the same. Here, to support the Foley's catheter, we started using about AA gun stillet. What is an AA gun? Is there? The back side will going to get the stillet. Same stillet you use to support the Foley's catheter. See the video. This is a case of an pericarditis. You can see that's a free fluid in the pericardium. Then, under ultrasound guidance, we placing in with an AA gun stillet. We place the catheter into the pericardial space. This fluid is draining. This animal immediately after the operation. This cost is less and you're getting effectiveness. If it is only serious or if it is only purulent, definitely you're going to get a very good result out of this. Okay, these some of the cases where we couldn't do much because they have been sent to us or maybe they will subject it to us in a later stage where all that's the internal organ has been failed. Here see, there's an ultrasound picture showing in a fibrous pericarditis. That is an animal, and this say in an we're going to read bread and butter appearance. It's the same thing is an fibrinous pericarditis. Then usually the most of the time animals show in a submandibular edema, brisket edema, and jugular pulsation. If that is the case, okay, now see this animal is having a submandibular edema, brisket edema, animal showing all the signs of a pericarditis. Here we are subjected for ultrasound, but here pericardium was not normal, but in left ventricle there was a growth. This growth is causing an filling, is preventing of a filling of a ventricle. That's why heart is not functioning properly. Then you're throwing the blood out of an auricle. It's going to the jugular vein. It is responsible for the creation of an brisket edema and also submandibular edema. That's this animal we followed, but animal is passed away. Then we can able to find it out the growth in the left ventricle. Then we subjected for histopathology. This confirmed that is hemangiosarcoma. This is regarding about the heart. I told you this ultrasound can be employed for a diagnosis of both an abdominal organs also. Yeah, you can use a linear probe and a rectal probe. You can say you can pass it to the rectum. You can diagnose it. Here, in case what we diagnose here is an intussusception. Here, one part of intestine, it will go to invaginate into the other part of an intestine, where animal can't able to pass the motion outside. Okay, then in this case, we are used the ultrasound to diagnose. We diagnosed, we done a surgery, we taken out the affected part of intestine, where then we have sutured the remaining part. This is a recovered animal. The owner is happy, they're ready to take out the animal to the native place. The ultrasound can also be employed for a diagnosis of the different swelling. What may be the swelling? It may be an abscess, or maybe a tumor, or maybe an cyst, okay, or maybe an hernia. Where if you place an ultrasound in the swelling, you're going to get some idea what may be the internal thing. Based on that, you can plan for the treatment, and again you can assess the prognosis also. Yeah, this is a simple case, umbilical hernia, maybe. We'll say most of the time if you see the swelling. But here, the swelling was hard. When you do an ultrasound, clearly we can say it's an umbilical abscess or an omphalitis, the inflammation of umbilical cord, rather than an umbilical hernia. Where it's a differentiation also, it will going to helpful for this. This is a one typical cyst we diagnosed as a ganglion cyst. These some of the animals showing a different swelling. That's we are subjected for a scanning. Okay, then we got in a different types of fluids. This is a one typical case is most common ganglion cyst is most common in a human. Okay, related to the nervous system, nervous tissue cyst. Yeah, we diagnosed in animal. We reported in a journal also, Indian Journal of Veterinary Pathology. The first report has been done for a ganglion cyst. Okay, the differentiation, it will go to helpful is a cyst or a tumor or an hernia like that. You can go for this. Maybe it's most of the time, if a swelling is there, we can say it may be due to the cyst or maybe tumor or maybe an hernia. Where if there's any tumor is there, then also it may be immature abscess or maybe tumor looks the same. Then you can go for a needle aspiration. You can subject it for the cytology. Then depending upon the cytology report, you can say it's maybe a tumor or it's an abscess like that. This is a typical case of a tumor. That's a that's an bulla appearance. It's a squamous cell carcinoma. This is the other method of squamous cell carcinoma. And again, I told you this ultrasound can employed for a diagnosis of an hernias. Okay, the different types of an hernias can be diagnosed. Maybe ventral hernia, lateral hernia, different thing. It is helpful to assess what type of an organ has been herniated most of the time, and it also helpful for you to plan for a what type of a surgery you can employ it, and along with that you can assess the prognosis also. This is a typical case of an umbilical hernia. Their intestines were the content of an hernia. This is some of the different types of swelling with the body. This is a one typical case, the huge hernia. See, animal not able to stand at all. It is almost a worst thing. We can see the discontinuity of a muscle. We can come across this may be an hernia. Then we subjected this one for a surgery. The fibrin clots were there because the long-standing hernia. You can see again the incision was not enough. We extended the incision. Then we put in a mesh. That's we have done an hernioplasty. See, intestines were the content. Then animal is, this is after post-operative. Okay, this is a huge thing to repair like this. This is a one more case. This animal was advanced pregnant animal. See, this muscle has been separated from the skin. In between the muscle and skin, you can see some cartilagens or maybe some intestines like this. These are the cartilagen and intestine. This is a typical case of herniation of uterus and also herniation of an intestine. In this case, we convinced the owner. First, we done an emergency C-section. We taken out the fetus. Then you place the content back. Again, we put the mesh. We had an hernioplasty. This is immediately after surgery and after complete recovery of an animal. See, where ultrasound, it's play a very important role to diagnose what type of an content and how best we can repair it. Again, this is a one typical case. See, when animal try to move, this is a condition where animal is not able to place an leg properly. And again, when make the animal to sit, is not possible to sit, it will go for recumbency. You can see the photograph, the huge swelling above the hatha. We thought it was an hernia. Then we subjected for an ultrasonography. Ultrasound shows there is no intestine or nothing. Only fibrin stands with an anaphoric area. We thought it may be an udder edema rather than an hernia. Then we subjected it for a surgery. You can see we removed around. Again, you had before surgery also we are doing an ultrasound to confirm. We removed around 50 to 60 liter of the free fluids and also fibrin contents. This is an animal after the surgery. See, still is need a time to come back to the normal. That swelling of an udder was reduced. Where the ultrasound, it's play an important role to assess what type of an content and what treatment plan you can able to plan. Coming to the conclusion, where the most often now is in a VDs or maybe most often a college they are supplied with the ultrasound machine. Most of the people are restricting the ultrasound for only the small animal. Here, my intention of presentation here, you have a machine, start placing an ultrasound probe onto the animal. It may be an sheep, or it may be an goat, or it may be in a cattle. We can diagnose the most of the diseases through with your clinical knowledge or with an ultrasound. You can diagnose so many diseases related to the thoracic cavity, related to the abdominal cavity, especially in a large animal. Okay, it's the time to take out your ultrasound, start practicing with your large animal also, where it will going to give you a satisfactory result by diagnosing the diseases, and you are planning for a different treatment protocol for the particular condition. It will be helpful for differentiating a different body swelling, and I told you abscess, cyst, hernia, and also tumor. And also it will be helpful to diagnose any deep-seated cysts are there, deep-seated abscess are there, that can also be diagnosed and effectively employed in diagnosis of different types of pericarditis. And nowadays it's large animal is gaining importance day to day. You can please start employing an ultrasound. So many diseases can be diagnosed, and you can see the movement of an organ also, where in X-ray we need to go for a fluoroscopy to see the movement of an organ. But here is non-hazardous and also non-invasive, easily available and economical. You can try it out. Only gelling is needed recurrent expenditure, other than nothing else. This is about my presentation on use of ultrasonography in a large animal practice. Thank you. Thank you, one and all. Madam. Any questions? That's Umar Rasul is an asking a question. The edema could be treated easily with a diuretic. If it is a small edema, it can be treated, sir. But when you say about is a huge swelling is there, you can give in a diuretic. What may be the diuretic? You can use it a furosemide or maybe potassium sparing diuretic. You may not get the result. Usually, when I am in working in a teaching hospital, I'll going to get the cases at the end stage only. They tried everything, diuretics, everything. Then only they presented to us. For that purpose, we started using so you gone for an ultrasound, and also we done a surgery for that. Someone is asking, that is again the cost of ultrasound machine. You may get it for 5 lakh also, 50 lakh also. Maybe depending upon a configuration, you may get it. Portable ultrasound for this large animal, around 68 lakh you may get it. Maybe if you want very good ultrasound, minimum 12 lakh is supposed to be implemented. Any other question? You can unmute yourself, you can ask. Hello. Any questions? Usually, this someone is Anil Singh is asking is an anesthetic protocol for a general anesthesia. In this case, we used a diazepam, then ketamine for the induction, then followed by we put it under general. That's an isoflurane. That's a large anesthetic machine I used for an pericarditis cases earlier. Because once you use a general anesthesia, is a problem is there. There may be chance of regurgitation. Again, animal is already compromised. Once you put it for a general anesthesia, we need to go for a casting. The casting again is a problematic. In that particular cases, we started improving a thing. Instead of going for a general anesthesia, we started shifting for a local anesthesia followed by an standing sedation. You can employ it in xylazine, ketamine, and butorphanol. You can mix it, you can use it. Xylazine, you can use it around 0.01. The butorphanol also 0.01. And the ketamine around 0.04 mg per kg body weight. Animal will be in standing position. Then give in a local lignocaine. You can go for an operation. You can try it out. Someone is asking dose of an ketamine. Ketamine is around 2 to 4 mg per kg body weight in large animal, and you can use a diazepam about 0.2 to 0.5 mg. You can use it. Or propofol also you can use around 2 mg per kg body weight. You can administer, induce it. Once induction is there, then you put an endotracheal tube, then you shift it for isoflurane, about 1 to 2% of isoflurane. You can plan for that. Like that, you can go ahead with this for a general anesthesia for the large animal. Any questions or anything? Maybe when you coming to the again scanning area, maybe you can say scanning area. I told you one is the diaphragmatic hernia. You can scan it on both left side and right side. If you get it on a diaphragm around 15 to sorry, reticulum around 15 to space in a normal animal, some extent you can suspect it for an DH. But in an advanced pregnant animal and also animal suffering with a vagal indigestion, if you get the reticular over fifth intercostal space, don't declare, go for a ruminotomy, then you can confirm the DH is there or not. Otherwise, you have an X-ray, you can do an X-ray, you can confirm it. The most of the time you suspect as a DH is there, then open up, you may not get it. Again, if any intersusception is there, or intestinal obstruction is there, maybe that's you can say take the history where the animal is not able to pass the tongue since around 3 4 days, and again is a rumen is impaction is there. Most of the time we veterinarian will struggle whether to open it on a right side or a left side. Here one simple technique I can say, if you have an ultrasound, keep ultrasound on the right flank region. You can check for an intestinal content. Maybe what is the diameter of intestine. If a diameter of intestine is more than 4 or 4.5 centimeter above, then open it on a right side. Open it on a right side, that will be a good idea. Instead of opening on a left side. If intestine say everything is collapsed, then open it on the left side, check for the omesal impaction like that. If someone is asking how to diagnose the plastic ingestion rather than reduced reticular contraction, it's a bit difficult to say whether the plastic is there because X-ray also may not be helpful. Ultrasound only we can say reduce reticular contraction. Other than that, whether plastic is there or not is a bit difficult to say. One, you can do a rectal examination. You can palpate the reticulum. Then, if any reticulum duffy is there or maybe the food material is packed very tightly, you can suspect it is a ruminal impaction. It's a case of a ruminal impaction. Then you can open up. If you get a plastic, then it's because of a plastic ruminal impaction is happened. But other than that, because that's a clear cut say is due to the plastic impaction is maybe difficult through an ultrasound or maybe X-ray also, because X-ray may not be helpful to diagnose a plastic impaction. This is about one is this one. Again is a heart. I told you when you plan it, I told you that's usually the probe size. You can use it as a convex probe will be good for the large animal from using it for an heart and everything. That along with that, you can use the frequency between 3 to 5. The 3 to 5 megahertz will be the good. You can apply depth nearly around 20 centimeter depth is needed to see whether the internal organs are how they are functioning. I told you this is a convex probe, 3 to 5 into there's a megahertz, 3 to 5 megahertz. The frequency is needed. That you can use it for that. When you come into the rectal ultrasonography, this is usually linear probe. We're going to use it around 6 to 10 megahertz frequency. The probe can be employed for diagnosis of a rectal. And again, this linear probe ultrasound can also be employed for diagnosis of a urolithiasis or maybe any bladder enlargement, bladder rupture is there. And along with that, you can check the urethra, how are they functioning. Sometimes you can check for the seminal vesicles in case of a large animal also. Like that, so many others can also be diagnosed on kidney. If any kidney stone is there, that can also be diagnosed.
Sir, please share your
Maybe
presentation.
a
Your
presentation is over,
presentation is not
madam.
visible.
Presentation is over,
Okay,
Amit.
thank you.
Okay, like that, you can use in a different types of an probe. You can go ahead with this. Any questions?
Participants, please ask questions. Your microphones are turned on.
If possible, turn on the videos also, madam.
Sure, sir.